Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County.
The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
ये bet me आया.
我们能够做到.
Podemos hacerlo por todos nosotros.
Idi manandarki sadyam.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
Hello and welcome everyone to the Friday update with Mendocino County Public Health. We're very happy to have County Health Officer Dr. Andy Coren here with us this afternoon. We'll get the latest COVID-19 updates for the county from him. Then we'll move into taking some questions from local news media. And we'll also be checking the Facebook and YouTube pages for public questions as well for Dr. Coren. So let's jump right in. I'll pass it over to Dr. Coren.
Thank you very much. And hello, everyone. California and now Mendocino County has entered into the Omicron blizzard. Nationally, the United States leads the world with almost 58 million cases and 382,000 deaths. We are exceeding all the records of new cases, exceeding the peak in last week's winter surge, according to Dr. Fauci. There have been thousands of airline flights canceled because of staff shortages due to COVID. Hospitals are hitting their limits, and other industries are overwhelmed, and supply chains are challenged around the country and around the world. Can I have slide one, please? Or the first slide? Next slide. In California, our case rate has increased to 88.7 new cases per 100,000. That is an increase of 73% in the last week. It may be undercounted also due to less reported antigen tests and also a backlog of processing PCRs due to the holiday. This slide shows test positivity, and the positivity is up 21%, 90% increase in the last week. We have exceeded the level of last winter's surge. As you can see, the rate of ascent on the right, the blue line, is much steeper than it has been for the other surges that we've experienced, and it is also significantly higher. Because of this surge and these data issues, hospitalization data is now probably more reliable to track, though that is also increasing at a slower rate because Omicron appears that it may be a little less severe. Nevertheless, California hospitalizations have risen by 65% in the last week, after doubling in the week from Christmas to New Year's to 19 per 100,000 people. Southern California leads, followed by the Sacramento area, San Joaquin Valley, Bay Area, and last and least is Northern California so far. And we often lag because of lower testing, and it is also possible because our populations are more dispersed. But Omicron does not seem to have reached us, although I will give you a preview that as of yesterday, I'm beginning to doubt that. We don't have the genome sequencing data to show it. The death rate in the state has not risen yet. Remember that deaths, the rate follows hospitalizations, follows the increase in case rates. Omicron is reported to be less severe, but again, it's too early to tell. However, if all of our hospitals are filled, there will be more mortality from COVID as well as other diseases. And if you or your family is one of the sick ones, statistics don't really matter. So let's have the next slide, please. This should show how rapidly Omicron, the one before that, I think. Oh, maybe not. It's the one that shows the two lines crossing. Try that's the one. Okay, terrific. So Omicron is showing this is showing how Omicron is really has replaced Delta in the in sequencing. So the green line here is the ascent of Omicron, and the blue, which we've been bothered by since last July, and of course much more in the fall, has fallen down in terms of the prevalence of sequenced cases. So at this point, the CDPH reports that in the week between December and the 1st of January, we were at 79% Omicron. The current level is higher, and the CDC looks at us as part of Region 9, which includes Nevada and a couple of the other Western states, and projects them to be at 95% soon. This is important because as we get over 80%, it's very questionable about using some of the newer treatments to treat the people who are mild to moderately ill. So we look at the prevalence data in this way. Another way to look at the replacement of Delta by Omicron is on the next slide. And so you can see on the last three bars, which just start on December 18th, how the relative prevalence of Omicron in purple has grown tremendously, and the number of, or the prevalence of Delta has fallen to a very small portion. And of course, other variants are an extremely slim line at the top. We know with very high degree of confidence now that Omicron transmits much faster, 50% faster than Delta. The doubling time is estimated to be 2 to 2.5 days. And as I mentioned before, California prevalence is estimated to be 79% at this time. Immune evasion is now also seen as highly confident, and that means that vaccine efficacy is only 30% 6 months after the second dose in the primary series. But after the third dose or the booster dose, the efficacy of our vaccines is 80% against Omicron. So although it is evading immunity, it is still susceptible when we have those boosters on board. Severity, it is still predicted with low confidence. We need more time to see, but the relative risk of hospitalization may be what it is with Delta or maybe a little bit less. Even if it's less severe, the modeling at the state levels show that hospitals' peak capacity will be exceeded toward the end of January 2022. Mortality is slowly increasing now, and it will follow the hospitalization increase by about 2 weeks. Of course, the other thing that we are concerned about and affects whether or not the infection was severe is long COVID, and we are going to have to wait a while to see exactly how significant that is for the thousands and thousands of people who have had COVID, whether they have had the test to prove it or not. So let's move on to the Mendocino data. The case rate on January 6th was 15.67 per 100,000, which is in the range of what it had been in the last 30 days. with a 7-day lag. But today, it has now tripled from the week ending December 25 to the week ending January 1st. And it is now 30.6 per 100,000. And this is also prior to the New Year's bump. Yesterday in our public health, we received records of 105 new PCR cases, and we also received 55 antigen tests, mostly from schools, and that has increased by another 160. We're about 200 antigen tests that are positive. So our CICT team here in Mendocino has been keeping up longer and in more depth than most of all of the other California counties. But with these high numbers, even with state assistance, we can no longer do that. Our orders have always said positive cases should isolate and should notify their own close contacts to test and quarantine. So this is especially important in the days of the antigen tests and also just the lack of tests. We're running into some problems ordering even the PCR test. So if you have symptoms or your antigen test is positive, please isolate in order to protect your families and your acquaintances and so on and so forth. We can't tell if there are new outbreaks or clusters quite yet. It takes some analysis, but if suspected, enterprises should call the call center to discuss outbreak responses. Also, if people need shelter or service, they will need a PCR to be eligible for those services, but if their need is urgent, they can have their provider call us at the call center, and we will try to accommodate them. We have in isolation now 386 people and quarantine about 300, and this doesn't include the self-quarantine people. We currently have 4 people that we are servicing with shelter. Our testing in the county has gone up. It is now over 400 per 100,000 per day. This does not count the antigen testing. PCR test positivity is 9.4%, and that is up almost doubled from 5.4% in the last week. Just to give you a sense, in California, the rate has gone from 3.3% at Christmas time to over 20% at this time. As I've been mentioning before, we have been using over-the-counter testing, and we want to let everybody know that this is an effort at mitigation for this surge. In other words, if people find a positive test or they've been symptomatic, they should self-isolate. They don't need to wait for a positive PCR result. These over-the-counter tests are available but scarce in pharmacies. The Mendocino schools have distributed 10,000 home tests to students and staff, way ahead of other counties, and our returns are helping to increase the safety of the schools upon reopening. These kids were told to test the night before and the day coming into school, and they've been doing that, and that's why we found a lot of new positive tests. Mendocino County Public Health also ordered and has distributed within 24 hours 14,000 free over-the-counter antigen tests over the holidays for groups with the lowest resources. And we wanted to do that for people to use before gatherings and if positive to stay home. We understand that the data coming into that from that will be sketchy in terms of understanding the prevalence and so forth of this disease, as we have relied on PCRs before. But this is a mitigation effort because we want people to understand and help themselves. Previously, public health would also provide a letter for businesses and schools to return there for people who have completed their isolation and quarantine. We have always required a PCR result for these and continue to do so. But for antigen tests, the Department of Public Health has also posted a self-attestation form for antigen results, but employers and others may require observed over-the-counter tests. And so they'll have to go a step further. Can we have the next slide, please? it does show, this shows the hospitalization rate. And it's important to see that, again, this number has increased tremendously. The largest number in light blue is Southern California, and then comes San Joaquin Valley in purple, and Greater Sacramento in red. Abajo is in the blue, and I'm not seeing Southern California. Southern California is light blue. There is a dark blue. I see the dark blue is mixed in between the purple and the red. For our point of view, Rancho is this green at the very bottom, and so our admissions have not bumped up that much, and they're just beginning to at the time that this slide was produced. So on January 6th, we had 5 Mendocino citizens plus 1 from out of county who was in our hospitals. 2 of our hospitals are already reporting some staff shortages. And again, that's probably because the hospitals are filled not with COVID patients, but in general. The available staffed ICU beds now is 3, which is a good number. COVID deaths now is 106 Mendocino County residents. I'm going to move on to outbreaks at this point. The only outbreaks that we now have formally is the sheriff's department in the jail, which are 15 staff, and now 2 antigen positive inmates. And these are all being taken care of and closely monitored, moved into separate isolation cells, and so on and so forth. There have been other outbreaks over the holidays. These have all resolved. And moving on to schools, this is an important area. Schools have had, as I've been mentioning, 45 exposure events over the past pandemic. This is before Christmas. A lot has been spoken about on the web and elsewhere about Fort Bragg Unified School District and their basketball tournament. We received some complaints that many people were not wearing masks. And then afterwards, there was an adult party, I think at a bar, where we got 19 antigen positive test results back. Fort Bragg Unified School District have since stopped their games until they can be assured of better compliance. Some have called for shutting down the school, but I don't think that's warranted. Our schools have been very proactive, in fact, exemplary, sending children the antigen tests home before any of the other counties in California, and they are returning now already as our schools have opened. In the first 2 days of school, the testing percent in Ukiah Unified and Fort Bragg Unified students was really only 2.5% positive, and that's low compared to Mendocino. On January 6th, we had received almost 160 antigen positive tests, though. These are predominantly from schools, we believe. But it's important to realize that these were caught before these children entered the school, and some staff before they entered school, and didn't expose others. These are now people who are in isolation, and their close contacts, if they had them in the community, are also being quarantined. And we're working with the school liaisons to find any outbreaks outside of the school, but also in case there is something that we can learn that may be happening within the school. And this would not have happened. We would not have caught these cases without the school testing and the vigilance. So schools are really the safest place for our kids to be right now. People not wearing masks, if not exempt, are breaking the law and should be excluded from schools as well as businesses. And if that cannot be done during practice or games, I would favor ending the event. For businesses that were raided with unmasked protesters last month who falsely claimed that they were being discriminated against, the county has written up an advisory showing the legal basis for our mask orders. Excuse me. I'm going to move on to vaccinations now. They remain our best hope for returning to normal, at least preventing the disease at this time. In the state, the unvaccinated cases are 4 times the number of vaccinated cases. 10 times more likely to be hospitalized, and the not fully vaccinated are 17 times more likely to require ICU treatment and to die. Regarding post-infection or quote unquote natural immunity, national studies have now shown that reinfection after a COVID infection, even within 90 days, is 5 times more likely than infection following vaccination. So again, vaccination is the key to keeping this germ at bay. As of January 6th, Mendocino County had distributed a total of 140,583 vaccines, and that is 70.2% of people eligible, which is over the age of 5 years old, that have been fully vaccinated. It's a little less than California, which is at 72.1, but it's still doing well. And actually, the vaccine rate in California has been dropping slowly. To all of our consternation, within Mendocino County, we're staying level at this point. As of January 6th, we had 28% of our community total population was boosted. And of those over 65 years old, 86.1% were fully vaccinated, which is greater than California at 81.5, and 57% of this group was boosted as well. All other of the age groups and race and ethnic groups are significantly less than 50%. So it's very important to get people boosted. The Department of Public Health hosted in-school vaccine events in the last month in the Ukiah area schools for 5 to 11-year-olds, which administered a total of 569 doses. Boosters have now, and this is new, been approved in California for people over 12 years old. So the 12 to 15-year-olds have been approved for boosters of both Pfizer. Moderna is not yet approved for under 16 years old. For others, the boosters are approved starting at 5 months after the primary series, rather than 6 months as it has been. The therapeutics are all very scarce, but we've started to get deliveries of them to the county. These are prescribed as for outpatients by physicians who need to be familiar with the use of these medicines. The first group is monoclonal antibodies, and one of the newest that we have is IvoShield, and this is for pre-exposure prevention of the COVID. And it's long-acting, but it's for the highest risk people, for example, transplant recipients, severely immune-compromised patients, and it is an intramuscular injection. Sotrovimab is another monoclonal, and the relative risk reduction for hospitalization is 80%. This is the most effective, but it is an intravenous infusion. And again, it should be reserved for those people who are highest risk and not current with their vaccines, put them at a high risk classification, and they should be at high risk for progression. RegenCov, which was the only subcutaneous monoclonal antibody, is still there, but deliveries will halt to California, and we will advise our clinicians to stop using them when the Omicron prevalence is greater than 80%. So that will be coming soon. BAM-EDI, another monoclonal that's been used in some areas more than here, is also going to be decreased, or is going to be stopped when Omicron is at 80% prevalence. So the oral treatments, antiviral antibiotics, are also coming online, and there are several new and exciting ones that have been approved. These are oral antibiotics that will be distributed through just a few pharmacies have gotten the contract so far. They will be twice-a-day capsules. The important thing is that we're going to want to start them at less than 5 days, and they have to be for people who are over 12 years old, mild to moderate symptoms, but very high risk because these are so scarce. The first one is Paxlovid, and it reduces the risk of COVID hospitalization by 88%. There are some drug interactions that, again, physicians need to be aware of. Molnupiravir is another one. That was one of the first ones released, but it turns out that it is less effective with only a 30% risk reduction for hospitalization. And we're considering that to also be a drug to use kind of as last resort, because the mechanism is a mechanism that alters viral genetic code, and there is a concern that it could potentially affect human code. And so it's contraindicated in pregnancy, and there are other reasons to avoid its use in children. If women are considering getting pregnant or they're breastfeeding, they should not get this. And in fact, men are to be, if they receive this, should be using contraception for 3 months, again, to prevent any potential genetic problems in their offspring. Remdesivir is a medicine that has been used in other indications for a while, but it also has a risk reduction of 88%. It does require an intravenous infusion every day for 3 days. But again, all of these, remember, if you're positive, you want to connect with your provider to see if you're eligible for this. Recent orders have been a big area of concern because so much has changed. And I think if we can bring up the next slide, we'll see where those exist here in Mendocino County's webpage. This is the webpage demonstrated, and next is all of the orders that we've done locally. So I'm going to go through these pretty quickly. In the state, there were universal masking orders, whether you're vaccinated or not, mask indoors in public spaces. And this was only to go till January 15th, but it has been extended to February 15th. We also advise an upgrade to medical masking or N95 type of masks. The cloth masks and gaiters are significantly less protective against Omicron. The local mask orders that I have written allowed exclusion for performers and presenters in venues where everyone was documented to be fully vaccinated. I have changed that to eliminate that exclusion. So if people are presenting or performing, they now have to continue to wear their masks to protect each other and the audience. In the state, there has been booster requirements that are increased now for healthcare workers, adult day and home care workers, and corrections. If exempt, they can test. There is increased testing for hospital and nursing home to twice a week. Again, the masks should be upgraded to medical or N95. Visitation has been reinforced to general acute care hospitals and nursing homes. They should be vaccinated and tested to be able to visit indoors. Tested if they need to visit. If they're only tested, they should visit outdoors, and only in extreme cases in patients who are in their own rooms, not joint rooms, would they be allowed for patients toward the end of life. There is a local upgrade to these vaccination and testing orders. We added boosters and included pharmacy and dental for EMTs and fire, to EMTs, fire, and law. Those orders that we had before, we've extended that to include boosters and to include the employees of pharmacies and dental facilities. We just completed, modeled after the state, isolation and quarantine orders for the public. And in a very brief way, of fully vaccinated and boosted, or if you're not yet eligible for a booster, that's considered a current vaccine status, and a test out option is available at 5 days if there's no fever and symptoms are resolving. And for those groups that are current in their vaccination status, they can be spared the time of quarantine, but should be tested at 5 days. And in all of these groups, they should be wearing their high-grade masks for at least 10 days. Isolation and quarantine orders have also been modeled after the state's orders for healthcare workers. Mega events were redefined to include those events that had greater than 500 people indoors, down from 1,000, and greater than 5,000 people for outdoors. And there are some testing and vaccination requirements as well. These are required for indoor events, and for outdoor events remain recommended. Travel has been changed. The CDC has recently advised to avoid cruises for now, and I would recommend checking with the CDC if you're planning any international travel regarding the destinations. Air travel is going to have requirements for vaccination and testing before leaving, and anyone returning to California from out of the state or out of the country will require a negative PCR or antigen test, and they should self-isolate or quarantine if that test is positive or if they have symptoms, and it is required for non-nationals. If not fully vaccinated, quarantine for 7 days is mandatory, even with a negative test, and if no test, quarantine is necessary for 10 days. Cal OSHA requirements, I'm going to, Cal OSHA said that their ETS guidelines would follow CDPH, but I just read an email this morning that that's being looked at more closely, so I'm not going to give any advice that may mislead people. If you don't know what the recommendations are for your workplace, contact your workplace. There are lots of requirements for antigen tests. Many enterprises will only accept reports of tests that are observed by trained testers, and the Department of Public Health cannot do that. So we posted a self-attestation letter for antigen test results. Remember, for the most part, these over-the-counter tests are for the community to be able to use to protect themselves. And so if you have symptoms or these tests are positive, isolate. Don't wait for a PCR. It is advisable to get a PCR, and we ask everybody to report the results of these tests. If you have questions, you can call our call center for assistance, and that is 707-427-2759. So just to summarize, this is a viral firestorm. We are seeing the numbers of cases soar, and we expect that the hospitals will be very much impacted, but it will take some time, and it'll take a little more time before we see deaths coming from that. The epidemiologists and modelers say it will get worse towards the end of January in the hospitals, and that's if we're lucky, because it may be slowing down by the end of February or March. And they're using some data that just is not as mature as we'd like to see. Prediction models have not had the time to be reliable. The assertions of Omicron being less severe than Delta are still uncertain, but even if it's true, the sheer numbers are overrunning our healthcare systems. So if you're sick, you can still get very sick if you're not current in your vaccinations. Best defense is vaccines and boosters. And as you can see, Mendocino Department of Public Health is on a mobilization footing, but there's only so much we can do. So my advice is to protect yourself and your loved ones. Postpone travel, avoid parties and gatherings. If you're going to have them, make sure that they're smaller, and if possible, all people should be vaxxed and boosted and even test beforehand. Smaller, I would consider less than 12 people, and it's best if it's within your family group. Dr. Tomas Aragon, our California Public Health Director, has developed an acronym called GUTSI, G-U-T-S-I, to remember all the things we can do for ourselves. One, get vaccinated. And now it's all people from 5 years old and up, and boosters for all people over 12. These are working against Omicron, but they should be current in their vaccinations. And don't forget to get influenza vaccines when you're getting your COVID vaccines. They can be done at the same time. Upgrade your masks. High quality masks, including the medical masks or N95 type mask, should be used, especially around vulnerable, elderly, or otherwise compromised people that might be in your household or at work. Test to find even the asymptomatic people. Test before parties, before work, before school. OTC and over-the-counter antigen tests are good. PCRs are also good. If the antigen rapid tests are positive, then you should definitely isolate yourself and let your close contacts know. Stay home if you're sick or you have a positive test. And improve ventilation for institutions. That would be open windows and doors, check the HVAC systems, and if possible, on the nice days, have your activities outdoors. And with that, I'll close. Thank you for listening, and I'll be here for any questions.
Thank you for the update, Dr. Coren. So we'll move into taking some questions, and we have about 25 minutes left. So for the structure, we'll go one question per outlet. And we'll also have a public question too in each round. And because we do have limited time, if you want to ask a follow-up question, that's fine, but just try to keep it brief so we can get to everybody equally. So let's start with KZYX.
Hi, can you hear me?
Yes.
Hi, so it sounds like rapid testing is a huge part of the strategy for getting ahead of the surge. And there's been a pop-up test that showed up in Ukiah recently, and we've had some listener concerns. People are just wondering how they can make sure that they're getting a valid test and that their personal information is safe. And I don't think there have been any allegations, but I'm just wondering how people can make sure that they're getting a valid test, that their personal information is safe, and what the requirements for these sites are and what kinds of local agencies oversee them. You mentioned that they need to be administered by a trained observer, and I'm just wondering if you could address those concerns.
That's a good question. We are aware of that testing site, and I don't know who is supporting it. I don't know how they're licensed. It does seem like they're doing a standard over-the-counter test and observing it, and I think they're giving a piece of paper out that might be useful at your place of business. And they are also sending off a PCR test. We do not have oversight of them, and we don't know who does.
Okay, thank you.
Thank you, KZYX. And next we have Mendocino Voice.
Hi, thanks. So I have another question about testing as well, but sort of on the more general side of things. The county gave out a bunch of free tests and the schools have given out a bunch of free tests, but there has just been, nationally and locally very limited availability in terms of anyone being able to actually get their hands on those rapid tests at a time that they might need them. And you also mentioned that there had been some difficulty with ordering PCR tests. And so I guess I was hoping you could just elaborate on whether or not you foresee access to rapid tests as being a problem on the county and school side, and just how you anticipate the availability of tests locally going over the next month or so, and what people can do to access them in general.
Well, let me say that your concern is very well taken, and I'm just exactly as concerned as you are. It is really a mitigation effort, meaning that we're not depending upon it to figure out our case rates and that sort of thing. But it is important for people to have them when they're trying to get out and do their usual stuff. Think back to last year when we didn't have vaccines and we didn't have testing. And we didn't have a whole lot of other things. There was even masks and personal protective equipment in our hospitals. We are in a situation like that now with testing. And so I know that the California Testing Task Force is working as hard as they possibly can to get more antigen tests. As soon as I heard that they were going to be making some available if we requested it. And And then I followed up because it didn't hit our county fast enough. And, there were problems with the weather and transportation. But I think we got it as one of the first counties in the state. And we got a lot to pass out to those people who are the least resourced. The tests are available, but as you mentioned, scarce. And I keep hearing stories of people getting to the pharmacy at 7 and they're already sold out. But they are available in the pharmacies. The pharmacies, because the scarcity, have often put a limit on how many you can buy. And I would say to respect that limit, but stock up if you can. Certainly, if you know you're going to be going to an event in another few days, try and get those early. The schools were also informed that they could request those tests through the testing task force, and our county did a huge job in getting those and getting them out to the students before they even left at Christmas. I was on the statewide calls with the county officers, and they were asking, how can we get those tests at, and our students already had them. So we've done well, but I agree it is not good enough. And we are continuing to try and stay on top of this and request whatever resources become available. But there's a problem with manufacturing, transportation across the country. There are all kinds of supply chain issues. I know that our representatives in California Department of Public Health were checking every day on airline arrivals of their shipments and on the boats and every which way they could come in, and it just took a long time to do it. So we're in a situation of a tremendous surge and tremendous scarcity. So I would just say keep in touch and do the best you can to try. You may find a friend or relative has more than they can use for today and you really need it. Try and share it around. But this is hopefully to keep the community as safe as they can with as much testing as they can.
I guess just a quick follow-up with that. Do you have any personal estimates of what kind of undercount we might be getting, given the scarcity of available tests, or how many people might just be doing at-home antigen tests?
No, I don't. I think what the state people have said is that they really don't expect more than 20% of the results of these to be reported. These are distributed with a reporting mechanism through primary and another one through, I can't remember the name of the platform, but there is instructions that goes with these on how to report them. But the experience that the state has had with self-reporting doesn't give us a good way to estimate what it is.
Okay.
So, the other thing I would say in response to that question is we're turning more to look at hospitalization rates to see just the sort of extrapolating backwards, the volume or the prevalence of how much COVID is in our community. The Omicron variant is in the community. So we are looking at hospitalization data. And as you can see in Mendocino County, it hasn't gone up hugely, but we have seen our tests come in 10 times more in the last day than a few days ago. So, so it's not going to be perfect, but from a surveillance, more accuracy point of view, they're using the hospitalization data a little bit more.
All right, thank you, Mendocino Voice. And let's take a question from the public now. The first one is COVID going to be the new norm soon, like the common cold?
Again, you're asking for a prediction for me. I think people are saying, well, this is washing over the entire land, and maybe more people will be at least a little bit more resistant, immune, but we don't know, unfortunately, what the next variant could be. So we're on a big emergency footing at this point. I don't want to make predictions that it's going to be less or it's going to be continuing at a low level that might make people complacent. I also don't want people to to live in constant stress and fear, but somewhere in between is probably appropriate. So will it become endemic? There's a lot of predictions that it will become endemic. In other words, People here and there will have a cold and they'll get over it, or they may get sick and they'll get over it. The problem is, so far, the COVID viruses that we have can still cause horrible disease in the most vulnerable, and can overwhelm our healthcare system. So I think it's a little bit too early to tell. The other thing that's still a big unknown is what will long COVID look like? If it's like Lyme's disease or some of the others that go on for a long time, that can really have a huge effect on people's health and productivity. So I don't want to be optimistic, but it may develop into an endemic that is not serious, and it may continue for a while to have further surges. I think the best bet is to be continuing to look at it scientifically, and that's why I keep quoting the California Department of Public Health and their assessments, and put up some of their slides to show what they're finding.
Great, thank you, Dr. Coren. So let's go for round two. KZYX, I think you're up.
Hi, I'm wondering if you could go into some detail about the guidelines for testing. Who can establish the guidelines? Is it an employer? Is it public health? I'm just kind of looking for an idea of who gets to basically make the rules about this and what the requirements are.
Well, the state does create guidelines for masking and vaccinations and testing, and they do it for certain groups for certain reasons. Testing is not required for the general public; it's advised, and there's a difference between advice or guidance and rules. And the rules and the orders are there for people who could get sick and make many other people sick, or cause problems in our resources like our hospitals or police force, fire, or ambulance. And those are the groups that we really want to focus on. When they create their orders, I can follow them up with an order, or just refer the general public to the state orders. The state sometimes just defers to the CDC, but makes that public. And so there's not a wand that's given to one person or another, but we try and use principles to make those decisions.
It just sounds like there are some workplaces where even if the employees are fully vaccinated, they also have to test. And I understand that that's being done in an abundance of caution with this new wave, but I'm just wondering what the ramifications of that would be for people in this situation where tests are in such short supply. If they end up having to miss a lot of work and suffer economic consequences because of a policy that's sort of unclear.
Well, the employers are going to say whether they want testing in addition to quarantine, or testing in addition to vaccination. Remember, the vaccinations are not 100% effective. They are much more effective than going without being up to date on your vaccinations. But if the employer's responsibility is to protect their entire, if the employer's responsibility is to protect their entire employee staff and the public, then they're going to want to reduce the risk of infection, even by people who are fully, or as I've used the new term, currently vaccinated. And we do worry about the economic displacement and the costs for all these things, and the unavailability of tests. But we're trying to do the best that we can.
Thank you.
Great. And next we have Mendocino Voice.
Hi. So earlier you mentioned that hospitalization rates are potentially a more useful metric to be looking at right now in terms of the severity of the recent surge, but also that we have two of the hospitals are looking at potential staffing shortages, and that 3 ICU beds is a good number. So I know you're not a representative of the hospital, and they are not on this call right now, but I was wondering if you could just speak to what you know of current healthcare staffing challenges right now across the county, and what you might expect to see here locally, if you think that kind of end of January expectation might apply here, or what we could look at in Mendo.
Yeah, I'll make a stab at this. I'm not going to promise that it's going to be very satisfactory, but the hospitals report to the state every single day. And one of the questions they respond to on their form is, are they having some staffing shortages? And 2 of our hospitals do say that they've been having some staffing shortages, and that's not uncommon. They can bring in other employees from registries or from within their system. We are actually very lucky to have a very flexible Adventist health system with 3 hospitals. So if they're really strapped in one hospital, they can move a patient to one of the other hospitals. And that is what tends to happen. I haven't seen that happening at this point, and I haven't seen any of our Mendocino County patients being transferred out of county yet. That was happening last fall when we had our big surge in Mendocino County. We were at times unable to care for our own patients. There are times when we are not, and outside of the surge, outside of this infection, where we transfer out because of staffing shortages or because the care that's required just exceeds the care that we can give. So we are now on a critical staffing shortage footing with the hospitals, and they have already assessed their staff. They will consider doing some things like decreasing or selecting only some elective procedures, because that will free up not only rooms, but also equipment and nursing staff to be able to care for patients who may come in who don't need surgery per se, but enable the hospital to expand. And there are surge beds that each of the hospitals have. And then another avenue for adaptation to those shortages is opening areas of the hospital that would not necessarily have patient care licensed, but they are licensed during a surge. And so there are surge beds. And then the issue is finding the right numbers of patients. So this is a process, and we're in what we're calling a critical shortage process because we know it's happening. And part of that is assessing the needs and responding to them, cross-training people, and so on and so forth. So I think in our county, judging from what we saw happen in the fall surge, we have a very flexible hospital system, and I'm hopeful that we'll be able to see this through to the end without major crises. I think many people are used to reading what was true in Southern California and in other areas last winter, and even as recently as this summer and fall, where people were housed in the hallways, they were treated in ambulances, there were all kinds of shortages. We're not at that point now. I hope we'll not be at that point, but the predictions, the modeling shows that if this is a more severe virus, then towards the end of January, we may be exceeding the thresholds that we had hit in the past bigger surges for California. Remember, Rancho was lucky last winter, and then we were really hit pretty hard during the fall surge. So we've all learned some more, and I think that the hospitals are more prepared. We're hoping that even though the numbers of cases are prevalent in the community, hopefully we'll need less hospitalization for those people, less intensive care unit days. We've also improved our care of patients within the hospital. We understand that less people need early ventilator support, and there are other ways to support them. So I think I'm hopeful, but I don't want to be blind to the possibility that just like we are missing necessary testing this week, We could be missing beds next week. And if the hospitals to the south of us and all around us are also missing beds, then the care may be modified and may be less available than we would like it to be.
Thanks. I don't have a follow-up for that.
Okay, thank you, Mendocino Voice. So we have 5 minutes left. I'll do a brief question from the public, and then Dr. Coren, feel free to go right into your closing comments if you'd like. So this last question is, why should I be afraid of a virus that will not cause me any harm?
Well, that's a good question, and it reflects some misinterpretation of what's coming across in the media. I tried to address this before. Even though there may be fewer people who get this virus and wind up in the hospital in the intensive care unit or who pass away from it, it is still a deadly virus. And for the fewer people, if it turns out in the end to be fewer people who do get sick and very sick, we need to all worry that we're not among them. And so that's what we're doing now, trying to prepare for that. We're also in a different situation. We're in a better situation because we do have vaccines. But of course, this variant has shown some resistance to our vaccines, and we can only get around that if people get boosted. We're concerned about the young people who just recently have come online for their vaccines and for boosters. So there's a large number of people in our communities that are susceptible to the more serious manifestations of the disease. So while doctors and epidemiologists and public health officers like myself say, well, it may be a little bit less severe than the Delta variant was, A, we don't know that for sure. And B, less severe from a public health point of view does not really help the person who has COVID or whose parent has COVID or who's immune deficient. And that's why we need to worry about it. And we worry about it in a lot of ways. One is we protect ourselves and others by wearing a good quality mask. And the other is to get vaccinated and boosted. And to be tested helps you protect other people instead of going to parties and passing it around. You may be well protected, but your neighbor, your loved one, your child, your parent may get the bad kind of COVID. And it's happening to people who have no prior underlying diseases. So it is a severe disease, and that is why people should be concerned about it. And that's why I'm concerned about it. And most of the country is concerned about it. I hope that answers your question. So if you'd like me to just summarize, part of it is what I've already said. We're getting into a huge surge of a virus, and we have not seen the worst of this yet. Predictions show that even if it's mild, the numbers in the hospitals may exceed what we saw last winter and last fall here in Mendocino County. And if it's worse, it will happen sooner. It may happen for California in the mid to early part or the mid part now of January instead of waiting till the end. And even if it's milder, it could be in February. So we're confronted with a virus, and you can never look ahead with very much certainty, but we also haven't experienced an epidemic, a pandemic of this magnitude before. And so we need to protect ourselves and our community. At this point, locally, I'm really encouraging people to do as much as they can to protect themselves and their loved ones. That is very important because not only are the hospitals threatened, certainly more threatened in the Bay Area, Sacramento, Southern California than we are here, but what happens there frequently happens here a little bit later. But also because people who are at home can suffer some very severe consequences. And so the ways to do that are, again, to be vaccinated and boosted as soon as you possibly can, to wear a well-fitting N95 or at least medical grade mask now when you're around other people. If you are sick or you test positive on one of the antigen tests or a PCR test, please isolate and protect the others around you. And generally, be healthy. Use the usual recommendations that we have to eat well, exercise, sleep well, But you want to take care of yourself and your neighbors and your family and protect against this fairly prevalent and growing unknown threat. And so I'll wind up with that. We all need to be protecting ourselves and our neighbors. And while public health and the hospitals and our clinics and providers will do the best we can, it will come down to people looking after themselves. With that, I'll close.
Thank you, Dr. Coren, and thanks to our local news media and also everyone that listened and asked questions today. We'll have the next update in 2 weeks, so that's January 21st at 2 p.m., same time. So in the meantime, you can get updates on our public health website or the public health Facebook page as well. So hope you have a great weekend, and thanks again.
Thank you, and have a good day.